Hello, and welcome to a presentation on vocal health and hygiene for singers and actors. A quick introduction to who I am. My name is Justin T. Swain. I'm a second year doctoral student in vocal pedagogy with a specialization in voice research and science at Shenandoah Conservatory. I hold 3 degrees from the Ohio State University School of Music, a Bachelor of Music and a Master of Music and Vocal Performance, as well as a Master of Arts in Vocal Pedagogy. I have a plethora of additional certificates in vocal pedagogy from places like Boston Conservatory at Berkeley, the University of Wales Voice Studies Center, and I was also part of the inaugural graduating class of New York University's Vocology Certificate Program. I served on the full-time voice faculty at Ohio University School of Music in Athens, Ohio, where I was the coordinator of musical theater and contemporary vocal studies. I was also the lyric diction professor, meaning I worked with the classical voice students in their pursuit of singing repertoire in Italian, German, and French, as well as several different dialects of English. I also served very briefly on the voice faculty at Otterbein University, where I also worked with the contemporary and musical theater students. So, quick agenda overview. We've already done the introduction. Ta-da! We're on the agenda, obviously. Next, we're going to talk about why vocal health matters. We're going to discuss short and long-term things that you can do to promote vocal longevity in your instrument, and we're going to be spending the majority of our time there. Then I will conclude everything with some final thoughts. Quick disclaimers: if you have any questions about anything that's discussed in this video, you can leave them as a comment on YouTube, or you can shoot me an email at justin@theswainstudio.com, and I'm more than happy to assist you. Thanks for being here. You are going to learn a lot of new information, I hope. At least that's my intention. And again, I am not a medical doctor. If you have questions about your vocal health, just very specific stuff, you should always consult a medical professional. I just happen to be a voice teacher who has taken a lot of coursework on this information, as well as someone who is fascinated by vocal function. So, your voice is like an instrument because it is an instrument. It's just like a guitar or a piano. It needs care to sound its best. Whether you sing in choir, you participate in musical theater productions, or just for fun, these tips are going to help keep your voice strong and healthy. But what does the voice look like, you might be wondering? Well, if you look over on the right, that is a picture of a structure in your throat known as the larynx. It helps protect the vocal folds. And what do we mean by this thing, vocal hygiene? It's not like when we jump in the shower or we take a bath. We're not washing anything, but we are talking about the different things that one can do to promote vocal longevity, vocal health within their vocal instrument. And we'll take a look at what that means as we go through this presentation. Your voice resides within the larynx, and if you find that little bump on the front of your throat, it might be quite small if you are younger, or if you are an adult, it'll be much more prominent, or if you are AMAB, assigned male at birth, and you go through puberty, it will also become quite large, okay? So, what are we
Pitch glide from your lowest to
reading
highest.
as seen from above? In this particular video, we're just doing pitch slides and all sorts of stuff, and
Nice.
they
She
have a
likes this
camera
thing.
through their nose
Hey, Mikey.
all the way down the back of their
No
throat.
vibrato.
Okay? As the vocal folds adduct, meaning when they come together or they close, air pressure builds up underneath them and they begin to vibrate as air passes through them, up and out of our vocal tract. Yeah, remember, your vocal folds are only about the size of your pinky nail, and we are zoomed in quite far on these vocal folds, okay?
Pitch glide
The
from your
vocal
lowest
folds
to highest.
themselves consist of several layers. There's an outer layer, an intermediate, and a deep layer, and hydration affects the way that they vibrate.
She likes this thing.
Okay? So, why vocal health matters. Your vocal folds are small structures in your throat that vibrate to make sound. As I said before, they're about the size of your pinky nail and they are less than a millimeter thick. That's really tiny. Adult vocal folds generally measure between 11 and 15 millimeters in treble voiced individuals and 17 to 21 in lower voiced individuals, meaning yours are likely much smaller, especially the younger that you are. Healthy habits help you sing better, longer, and with more confidence. Now, if you don't take care of your voice, they can get tired, meaning your vocal folds can get tired or even injured. A tired voice can sound breathy, it can sound very hoarse, it can prevent ease of access to different parts of your range, whether that's your high or your low, maybe even in the middle, and it can lead to further problems in the future. Healthy habits help you sing better, longer, and with more confidence. What are they? Well, hydration and nutrition, limiting irritation, vocal rest, and other things that we want to consider when we're talking about vocal health and hygiene. Your physical age, your body's maturity, meaning are you going through puberty? Are you prepubescent? Are you post? And the structural changes that happen within the larynx as well as the rest of the body as we age. Your hormones as well as your emotional state actually impact your voice as well. Several medications over the counter as prescribed medications as well, they can have different adverse effects on the voice. Individuals who take medications for ADHD or ADD, many of those medications, as well as allergy medications, can have very drying effects on the voice. So, some short and long term vocal habits that you can do to take care of your voice. Hydration is key. It's a common misconception that you only need to drink water during a performance for the voice to stay hydrated. It actually takes anywhere between 9 to 12 and sometimes as much as 24 hours for the water that you ingest to actually reach the deepest layers of the vocal fold tissue. Most literature suggests drinking at minimum 8 to 10 8-ounce servings of water per day. However, the amount of water that you must ingest is going to vary from person to person as well as the environmental factors that surround you. If you are living in a really, really hot or dry climate and you are quite prone to sweating because you sweat throughout the day, maybe you're walking outside, you exercise a lot, you participate in sports, etc., then you're going to have to increase your water intake. Conversely, if we have somebody who lives in a cold climate and they're not sweating, then they might not have to ingest as much water. Now, keep in mind, water intake is not just limited to the beverages that you ingest. There's also water content within many fruits and vegetables. Before you sing, you might want to use a mesh nebulizer, and those use 0.9% saline solution. If you have heavy voice usage at the end of the day, you will probably want to use a vocal steamer. Now, if you live in a dry climate, you might also want to invest in a cold mist humidifier and place that in your bedroom or in your office. Things to avoid: drinks that have drying effects or diuretic effects on the voice, and coffee is a big one. I just had my first cup of coffee of the day. Foods that cause excess mucus or are high in acidity. So I personally, I can't have dairy before I perform, or chocolate, or spicy foods, or things that are tomato-based sauces. They all make me very phlegmy, and that phlegm forms over the vocal folds, and they don't vibrate as efficiently or as clearly as when I don't ingest those foods or beverages. Now, obviously, many of us really, really enjoy coffee, and I'm not saying to never drink coffee again. However, you will want to offset the amount of coffee that you drink with equal or more parts water or things that don't have drying effects on the voice. You're going to want to limit irritation to the voice. And what can that look like? How often you shout or speak at an elevated level. If you're in a concert and you're in a really big auditorium, hopefully you get to use a microphone. Or if this is now at the parents or choir directors watching this video, perhaps if you have to yell a lot and your voice is strained throughout the day, invest in a personal amplification device if possible. Try not to excessively clear your throat, cough, or speak in vocal fry, as those can be very irritating to the vocal folds. Excessive glottal attacks, which mean forceful closure of your vocal folds, typically followed by an abrupt release of sound or breath pressure, things like uh-oh, uh-oh, or if we go to belt and we're like, ah, ah, those are very forceful ways to close the vocal folds. They yield a loud sound. However, when used all of the time, that can lead to a lot of different issues within the voice. So we want to avoid doing that when possible. We want to also avoid whispering whenever possible. Instead, just speak at a lower volume. When we whisper, we do not have clean adduction or closure of the vocal folds across the midline. Okay, and that can lead to irritation of the voice as well. It goes without saying, you shouldn't smoke or vape. You should avoid irritants such as dusty, dry, or overly odoriferous environments, meaning smelly environments. You're going to want to monitor the foods you eat, as I've said before, and you're going to want to develop and maintain a warm up and cool down routine that can be executed first thing every morning, especially on days you know you will require intensive vocal usage. So, why do we warm up? How do we warm up? What are good, simple, proven methods to warm up? I want you to pause the video here and just think for a couple of minutes. And when we go to the next slide, I'll give you some reasons why we do that. And then also for singers, how do we choose songs? Where do we find reputable voice instruction? What's a good range for your voice type? And what should you avoid? Reputable voice instructors can generally be vetted, meaning sought out and kind of investigated, researched by parents that you trust. Obviously, you trust your parents, I would hope. What I meant to say is choral directors that we trust or adults that we trust in our life. Maybe our music teacher at school, our choir director for CYC, if your parents were singers, or if they are just interested in learning more about the things to look for in a quality vocal instructor, you're more than welcome to reach out to me. Again, I'm the owner of the Swain Studio, and there are 6 other individuals who teach voice here, all of which are personally vetted by myself. When we are looking for songs to sing in a healthy manner, we want to default to the singer people or teachers in our life. And so that's one of the many reasons it's important to invest in a reputable voice instructor. All right. Did you pause the video and answer those questions? We warm up to reduce the risk of vocal injury, to prepare the many muscle groups responsible for breath control, phonation, meaning making sound, to do their jobs effectively and efficiently, to self-assess and self-monitor how our voice is responding on any given day, to prepare ourselves mentally and to get in the zone for performance or practice. And then some quick warm up tips. We want to determine on any given day or practice session what style of singing we're going to be doing. If it's high intensity belting or screaming, or if it's lighter, airy, wispy, or is it just quite conversational and how we use the voice? Those are all going to determine the kinds of exercises that we're going to use when we are warming the voice up for singing. We want to design a warm up for what we'll be putting our voice through and what style of singing is going to be demanding of our instrument. And our voice teachers or our choral directors can help with that. We want to also use the warm up to self assess what is or is not working within the voice. So, some short things that you can do that are easy at home or even on the go. Breath control and breath support. The breath is the fuel of our voice, and singing starts there. So, in order to wake up our muscles and get all of the different systems just moving and being well coordinated, we want to start with things like hisses, S or shh, sk, sk. And as you do that, you're probably going to feel things in your abdomen. You might feel your rib cage start tensing up a little tiny bit as we resist the airflow using our lips, our teeth, our tongue, etc. We want to stretch the voice, and we can do that via SOVT exercises, semi included vocal tract exercises. So things like lip trills, tongue raspberries, straw phonation, mouth trumpet, voiced fricatives, humming, etc. What are lip trills? Tongue trills, tongue raspberries, straw phonation, one of my favorite things. You place a straw in your lips, and you want to make sure that you feel vibration right where the straw is inside of your mouth, okay? Mouth trumpet, voiced fricatives like v or zh or z, or humming. Now, resonance, finding focus to the sound. We can do so by humming, and chewing while humming is also great. But when we are humming, we want to observe where we feel vibration within our vocal tract, meaning it could be here in our mouth. Maybe we feel it in the bridge of our nose. We are always going to feel some sort of vibration here in our throat, directly behind our Adam's or Eve's apple, the thyroid cartilage, because that's where our vocal folds are, right? We might also feel it on the roof of our mouth. We might feel it along the back part of our throat. Just be mindful of where you feel those vibrations happening as you hum. So if I have, I feel that very high in my nose. If I'm going, I feel a little bit of that here on my bottom lip, but then also in the back of the throat. Things like NG sounds, like the NG at the end of the word song, we can use those to do sirens, as well as scales. And as we're doing that, we also want to be very mindful of where we feel vibration within the vocal tract, just like when we were humming. Articulation, how we form the sounds. Our articulators are our lips, our tongue, our teeth, our jaw, your uvula, the soft palate can also be considered an articulator. But for the purpose of this, we're just going to talk about the jaw and the tongue and the lips. So things like gullah, 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 get the back and the front of the tongue moving. Lila, 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 li. That will get the front of the tongue moving. Mama, 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 ma. That's going to get the lips, as well as if you're chewing with the jaw, mama, 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 mama. Then it will also get the jaw moving as well. Those are just a few very short, easy things that you can do without a piano, without a accompaniment track, or anything like that while you're on the go. Now, I asked the question, would you run a mile and immediately stop all activity? Or would you walk for a few minutes afterwards to bring the body back to a state of balance, for the heart rate to return to normal, for your breathing to return to normal? Yes, of course you would, right? That's our cool down when we exercise, but we should also cool the voice down as well. However, when we are cooling the voice down, it should not be intense. Gentle humming and otherwise light vocalization are generally recommended. Slow inhalation and exhalations will also help us return our heart rate to our normal resting position. Okay? As far as the gentle cool downs, we can absolutely still do our hums. We can sing through a straw. But it's not about it being loud. Okay? Next, Vocal rest. Just as when we rest our bodies when we sleep, so too should we rest our voice throughout the day. With my students, I oftentimes use the mental image of a fuel gauge or a vocal fuel gauge that we have throughout the day, and that gauge can only be refilled through sleep and resting the voice. Once we run out of gas, we're done, we're on empty. When we practice, we don't always have to sing uh, full out. We can mark, meaning we can half sing. We can mentally or silently practice our songs as well. And that process is called audiation, when we internalize the sound without actually making sound. If you're preparing for an audition and you're really, really focused on your acting, well, guess what? You can always just set your phone up and silently sing while focusing on your acting. That way, you can go back and watch the video and see what was or was not effective in the acting. That way, you're saving voice. Now, if you are somebody that studies with me eventually and you just keep losing your voice, I might have you keep a vocal log or a vocal journal as a mindfulness exercise. And in that, we would track our voice usage throughout the day. If the only time that we find that we are resting our voices when we are sleeping, we're going to probably consider scheduling some silent time as well. All right. Next, quick review. Maintain adequate hydration. Use efficient vocal techniques. Incorporate regular vocal warm ups and cool downs. Avoid phonotrauma, meaning things that can hurt the voice, such as yelling, excessive throat clearing. Manage your voice use and allow for vocal rest, especially after heavy voice use. Optimize your overall health habits, your sleep, nutrition, etc. Limited exposure to irritants such as smoke, allergens, excessive caffeine, and alcohol for the adults that are watching. Manage reflux and respiratory conditions that can affect the larynx. Monitor early signs of vocal fatigue or hoarseness and seek evaluation when needed, and we'll talk about that in a couple of slides too. Engage in periodic check ins with voice professionals, such as voice teachers, speech language pathologists, or laryngologists. Now, when should we consult medical professionals? Generally, we say if things persist for more than 2 weeks, that is, vocal hoarseness that just refuses to go away, frequent vocal fatigue, meaning you just keep losing your voice no matter what, you experience frequent vocal strain or frequent heartburn, or if you have severe or moderate allergies which interfere with phonation, singing or making sound. So, some final thoughts. Sing and speak with a well supported sound. And if you begin to run out of breath at the end of a sentence, breathe, because if we don't, then we start recruiting, meaning we start engaging extra muscles that don't need to be used as we squeeze out that last little bit of air, and that invites extra tension into our vocal instrument. We want to be mindful of our voice usage. We want to practice good vocal hygiene regularly. We want to reach out to medical professionals when voice issues arise and persist for 2 or more weeks. And when in doubt, ask your voice teacher, your choral director, or a parent or guardian. For the parents or adults watching this video, you can read the full contents of this presentation's contents at theswainstudio.com. If you're on a PC or a laptop, you're going to want to scroll down and you will see a gray section that looks like this. If you are on a mobile device, such as a phone or a tablet, you'll want to scroll down and eventually you will see it. So once again, thank you so much for attending. My name is Justin T. Swain. You can reach me at my personal email, justin@justintswain.com, or my professional email, justin@theswainstudio.com. You can learn more about me by visiting my website, justintswain.com, or you can learn more about my studio, my music school, where I'm not the only one that teaches. We teach violin, piano, and voice is our specialty at theswainstudio.com. You can check us out on Instagram or Facebook as well. I hope that you learned something new today, and if you have any questions, feel free to reach out. Again, thanks for watching, and cheers to your vocal health.